Hi everyone, welcome to the Lakeview podcast series, and I'm pleased today to be joined with Tretobia Sharkey, who's with Sundance Hospital in Dallas, Texas. Welcome.
Thank you.
You go by Miss T too, don't you?
Yes, ma'am.
Okay, Miss Yes, ma'am. Now I know we're talking to somebody from Texas. Well, we're really excited to have you here in Jacksonville, and really interested in hearing more about Sundance and what Sundance does for people in the Dallas area. But before we do that, we're always interested in learning more about you. What do you do at Sundance?
Well, right now at Sundance, I'm a discharge planner / case manager for Sundance. I deal with the clients that first come in with psych and detox for alcohol and drugs.
And you help find placement for them?
I do. I help find long-term placement care because we're not a long-term facility. So we normally detox them through the first 7 days. And then we find if they want longer-term treatment, we find longer-term treatment for them.
What are you seeing as far as the typical drugs and alcohol that are coming in the Dallas area? I would imagine it's probably not all that different than other parts of the country.
It is not. We see a lot, all different drugs, out in alcohol. And so normally if they want they're not ready for long term, then we also have an IOP program. We step them down to our IOP program. They can go there for 4 to 6 weeks.
Okay, so your program, Sundance, has the capability of treating children as young as 5 all the way into the older mature adult age of 60, 70, 80, correct?
Correct. We do geros. We do kids. So our ages, we always say from 5 to 99.
5 to 99.
Yes, because we have adolescent, girls, boys, PDs, and then we have our adults, and then we have our gero adults.
And you work with the adults primarily.
I work with the adults.
Okay. What are you seeing most often when they're coming in? What are some of the biggest issues that you're seeing when they come into your program?
Most I see is drugs. We have some psych, but more drugs and alcohol. And there is a lot of new things that they're trying, and they pretty much mess them up. So it's a lot of different drugs. So I would say drugs.
So when they come into Sundance, if they're someone that's over the age of 18, tell me a little bit about what they would expect when they come into your program.
Well, most adults, when they come in, they'll sit them down and do a treatment team, and they do treatment plans with them. What we do is we sit them down and we go over, what they're going to go, their daily scheduled program. We get them a therapist, psychiatrist sees them, and we start them on detox protocols. Most of our psychiatrists, they start them on depending on what they're there for. The detox protocol, and we'll get them stable at least 7 days. Sometimes it takes a little longer, and but we don't kick them out. They'll stay as long as they need it, and then we'll transition them into somewhere longer term.
And so there's no 12-step, or is there some sort of support program for them?
We do not have a 12-step.
Okay.
Because like I said, we're not long-term. So we usually, my job is to find them a 12-step or a longer-term facility.
I understand. Okay. So really you guys are doing crisis stabilization, really?
Correct.
Okay.
Correct.
Okay.
And then we send them, either they'll step down, like I said, step down into our outpatient program, or if they want longer-term inpatient, then I find them longer-term.
Okay. Well, so what would you say to someone who was looking for treatment in the Dallas area that needed access to your service? What would you say to someone who is listening today and they're just not sure what to do?
We have a crisis line, and I would, we have 3 facilities, 2 inpatient facilities, and they can call the crisis line. Sundance Crisis Line is open 24 hours a day. We have someone in our crisis and intake department that is there 24 hours.
And how do they get in touch with them?
We have 2 facilities, so they can call either facility, the one in Arlington, Texas, and then we have one in Garland, Texas, which is our Dallas area. And they can call the 469-440-5566. That's our Garland number. Or they can call the Arlington one, and it's 817-583-8080.
Wonderful. Well, thank you so much, Ms. T, for taking the time to join us in Jacksonville.
It's my pleasure.
Really good to have you here. For those of you that are listening and you're looking for access to inpatient residential treatment, feel free to give us a call at 866-887-0142. Or if you're not ready to make that call and you want to learn more about our program, visit us at lakeviewhealth.com.